Okay, for the first client who had the miscarriage, counseling on sexuality and family planning. So now that your miscarriage is complete, I understand that you are wanting to get ready to start trying again. My recommendation would be to wait at least a full cycle before you start trying again, just to give your body a little bit more time to heal and just to make sure that all the products from the miscarriage have passed and that your body is able to function normally. I think that would be best. As far as having intercourse, whenever you feel ready, go ahead and have intercourse. That first time it might be sore or painful. So just use lots of lubrication. Be sure to take your time. It's always beneficial to have a conversation with your partner to let them know that, I would like to try to have sex again, but I'm not sure how it's going to feel yet, or if it's going to be painful or enjoyable yet. And so just having that conversation that if it is uncomfortable or painful, that at any time you can stop and that it's going to be okay for both of you. Like I said, take your time, use lots of lubrication. Sometimes foreplay is helpful. If there's any type of emotional energy, which there certainly could be attached with sex, that's another good reason to have that conversation. That maybe you're not ready yet, and that's okay. It's okay to take your time. Okay, as far as the client who had the abortion, I would talk about ovulation. Now that you've had your abortion and that the procedure has been completed, I thought it would be a good idea to talk about contraception. I understand that this was an unwanted pregnancy and that you're not ready to become pregnant again. If that's now or in the future, that's a good thing to consider when thinking about contraception. So, good contraception that works right now that you can use right now would be condoms, diaphragm, cervical cap. Those will all prevent pregnancy at the time of intercourse. And like I said, condoms, you can just go straight to the store and pick them up. Those are really convenient, easy to obtain contraception that would be good to use. All the other over-the-counter stuff like spermicide, the female condom, those are all pretty easily attainable. Sometimes diaphragms, you can order them just online, but it might be beneficial to see another provider to have one fitted and to talk about that to see kind of which option you want the most. As far as hormonal options, oral contraceptive, so the pill, this is something that needs to be taken every single day, so that's important to remember. If you have a difficult time remembering every day, that might not be the best option for you. The patch and the injection are things that are done either monthly or every 3 to 5 months. And so those require less thought and remembering. Those are things to consider. As far as the injection goes and the patch, it's good to consider your lifestyle to know if it would be good for you. I believe like migraines and smoking, it won't work if you are experiencing either of those. For the IUD, there's both a hormonal option, which lasts 3 to 5 years, and the non-hormonal option, which lasts 10 to 12. If you're wanting that long-term thing, that's something that we can discuss with your risks and the different risks associated with both of those, which would be important to understand before making that decision. If you're wanting something permanent, the surgical options for you would be a tubal ligation. That would be the best and safest option at the moment, most likely. If you're wanting something permanent for your partner, the vasectomy is a safe option that would be permanent and definitely long-term for both of those. As far as intercourse goes, whenever you feel ready, go ahead and resume sex. If you have questions about the physical aspect or the emotional aspect, it's important to remember that you may have some emotional energy down there. And you just had this procedure, so it's going to be sore and it may be painful. So be sure to take your time and have that conversation with your partner about having that safe word that if at any time, it's not comfortable or it's painful, that you can stop and that it will be okay. If you have any other further questions, be sure to let me know.